quality is poor, like it is now, then outside activities should be mitigated as much as possible, and no strenuous activities. This is not a great time to run a marathon. Avoid other air contamination exposures like smoking cigarettes and smoking marijuana. Probably a really good time to avoid that. But don't take this as if a couple of breaths is going to kill you, because there's no evidence of that.
So far in the pulmonary clinics, we have not had a major change from our usual business. There's not been a big increase in the number of visits. And I've heard it's been the same so far in the emergency room. It tells us that people are managing fairly well. They're probably changing some of their usual habits and staying indoors.
Work is probably as safe as any other spot. Traveling between locations in a car, probably put your heating cooling system on recirculation rather than getting outside air into your car.
If they are walking for short periods or short distances outside, it's fine to walk at a normal pace. The same is probably true for low-level biking at low speeds. If they're going for short periods and they're not exercising on the bike and maintaining a normal heart rate and respiratory rate, then that's probably okay.
You know, these short distance, short exposures are really fairly minimal, and I would not even recommend that they wear a mask. Number one thing is you got to get the right mask. It's got to be fitted properly. So there are several different masks out there, different vendors. They're not all created equal.
Surgical masks, again, provide no protection at all. All the air will come in around the sides of that mask.
The N95 masks we're used to using in the hospital. They're very good masks. You need to use a two-strap mask that fits above and below the ears. And it has to be pretty snug. We would recommend them for patients who have asthma, who are experiencing some more symptoms, certainly, and some patients with emphysema and heart disease. But everybody doesn't need these for short distances outside.
Those at risk, such as the elderly and those with heart and lung disease, and the young children in particular. I think it depends on your condition and your situation and your underlying health, and really you should be talking to your doctor, visit your local clinic, and get that advice.